Hello and welcome. Today we'll be discussing drug-induced myasthenia, a fascinating yet potentially serious neurological condition. We'll explore its causes, how it affects the body, how it's diagnosed, and what can be done to manage it. Let's dive in. Drug-induced myasthenia, as the name suggests, is triggered by certain medications. While myasthenia gravis itself is an autoimmune disease, drug-induced myasthenia arises as a side effect of particular drugs. Some of the most commonly implicated medications include penicillamine, which is used to treat conditions like rheumatoid arthritis and Wilson's disease, and certain aminoglycoside antibiotics like gentamicin and neomycin. Other medications such as neuromuscular blocking agents, beta blockers and statins can also, in rare cases, contribute to the development of this condition. To understand drug-induced myasthenia, it's helpful to know a bit about how nerves and muscles communicate. Normally, a nerve impulse triggers the release of acetylcholine, a neurotransmitter, at the neuromuscular junction, the space where the nerve meets the muscle. Acetylcholine binds to receptors on the muscle cell, causing it to contract. In myasthenia gravis, including the drug-induced form, these acetylcholine receptors are either blocked or reduced in number. Penicillamine, for example, is thought to alter the immune system, leading to the production of antibodies that attack these receptors. Aminoglycosides, on the other hand, can interfere with the release of acetylcholine, disrupting the communication between nerve and muscle. This disruption leads to muscle weakness, the hallmark of the disease. The exact prevalence of drug-induced myasthenia is difficult to determine, as it's often underdiagnosed or mistaken for other conditions, including idiopathic myasthenia gravis. However, it is relatively rare. Individuals taking medications known to induce myasthenia are at a higher risk. While it can occur in individuals of any age, older adults are often more susceptible due to increased medication use. The signs and symptoms of drug-induced myasthenia mirror those of myasthenia gravis. The most common symptom is muscle weakness, which often fluctuates throughout the day. It typically worsens with activity and improves with rest. Commonly affected muscles include those controlling eye movement, leading to double vision diplopia or drooping eyelids ptosis. Facial muscles can also be affected, causing difficulty with chewing, swallowing, or speaking. In some cases, limb weakness can occur, affecting activities like walking or lifting objects. Respiratory muscle weakness is a serious complication that can lead to shortness of breath and difficulty breathing. Diagnosing drug-induced myasthenia involves a combination of clinical evaluation and diagnostic testing. A thorough medical history is crucial, especially noting any medications the patient is taking. A neurological examination will assess muscle strength and reflexes. Several tests can help confirm the diagnosis. The edrophonium or tensilon test involves injecting a short-acting drug that blocks the breakdown of acetylcholine. If muscle strength temporarily improves after the injection, it suggests a problem with neuromuscular transmission. Blood tests can check for antibodies against acetylcholine receptors or other muscle-specific proteins. Electromyography or EMG measures the electrical activity of muscles and can reveal patterns consistent with myasthenia gravis. Repetitive nerve stimulation can also be used to assess neuromuscular junction function. Drug-induced myasthenia is typically not classified into subtypes like other forms of myasthenia gravis. The primary distinction is its etiology, that it's caused by a drug exposure rather than being idiopathic or autoimmune in nature. Therefore, the management strategies are more focused on addressing the causative medication. The first and most important step in treating drug-induced myasthenia is to identify and discontinue the offending medication. In many cases, simply stopping the drug is enough to resolve the symptoms. However, if symptoms are severe or persist, other treatments may be necessary. Cholinesterase inhibitors, such as pyridostigmine, can improve muscle strength by preventing the breakdown of acetylcholine. Immunosuppressants, like corticosteroids or azathioprine, can suppress the immune system and reduce the production of antibodies attacking acetylcholine receptors. In severe cases, plasmapheresis or intravenous immunoglobulin (AVOT) may be used to temporarily remove or neutralize harmful antibodies from the blood. The best way to prevent drug-induced myasthenia is to be aware of the potential side effects of medications you are taking. If you are prescribed a drug known to be associated with myasthenia, discuss the risks and benefits with your doctor. Be vigilant for any signs or symptoms of muscle weakness and report them to your doctor promptly. Consider alternative medications if possible, especially if you have a family history of myasthenia gravis or other autoimmune disorders. The prognosis for drug-induced myasthenia is generally good, especially if the offending drug is identified and discontinued early. In many cases, symptoms resolve completely within weeks or months. However, some individuals may experience persistent weakness, even after stopping the medication. Recent research focuses on identifying specific genetic predispositions that might make certain individuals more susceptible to developing drug-induced myasthenia. Additionally, studies are exploring new therapeutic strategies to more effectively manage the symptoms and improve the long-term outcomes for those affected.